We are live, ma'am.
Thank you, Sapna. Sapna, are you going to be introducing, or should we just start?
Yes, ma'am. Please start.
All right. So, good morning, everybody. We have been now nearly for a year doing these COVID updates, and hopefully we will not have to do many more of the COVID update. But we had started a series on inflammation and come to the conclusion that having an anti-inflammatory lifestyle is the way forward. So in that series, आज हम briefly COVID situation in the world we will see, and then we will move on to one pillar, which is very easy to correct, and we can start making the changes from today. Everyone can start making those changes from today, and that pillar is sleep. So you can actually really sleep your way to good health. So let's start. So here we go. So the last week has seen a lot of countries lift all mandates, and UK, Israel also over the last weekend. A lot of European countries, including Sweden, Switzerland, Norway. So mandates are going. The WHO has also come up with the statement that the acute phase of the pandemic is over. If we look at the world graph, UK still has about 950 cases per million. Japan, if you see, also is just kind of turned the corner, still has about 650 cases per million. US, definitely now the graph is going down. A lot of US states have, at least for local travel and local administrative purposes, lifted the pandemic mandates. India, South Africa, and just for reference, I'm putting Ethiopia here. So we are on our way out. And if you look at these three big players, we were saying that if the R value gets to below 1, the disease transmission is to less than one new person per case, which means that the growth of case numbers will stop. So we see here that the big three have hit the 0.5. If you look at how the Omicron, if you see this graph, the shape is the same everywhere. It starts off a little slowly, has a significant rise, and then almost a vertical rise, then flattens out. So the sigmoid shape is typical of Omicron and in every country. Omicron right now is, whether it is the 1 or the 2 variant, is now the main variant all over the world. If you see these slight gray patches, you realize that there are some unidentified or uncharacterized variants which are still there. So the variants will continue to emerge. We have to not let go of our personal protection and care. However, the in the last 2.5 years, we have, as a race, begun to identify the virus, whether through vaccination or through a natural infection. And also, we as a community have learned so much science about it that we are better able to deal with it. We were lucky that Omicron was a mild variant with high infectivity and infected almost entire populations. The estimates are that the real numbers might be much, much, much higher globally. So people who were not able to get vaccinated also have, through Omicron, developed some immune memory. If you remember this graph that we had seen a couple of weeks ago from CDC, so definitely, if a person is not vaccinated and has no previous exposure, the disease incidence is pretty high, and also the outcomes are not so great. Hospitalization, severe disease is pretty high in unvaccinated people who are naive. But if we look at vaccinated, if we look at, that's the green line. If we look at the light blue line, which is vaccinated with previous infection, and if we look at that black line, so this the light blue line is the one which is unvaccinated but with previous infection, and the black line is vaccinated with previous infection. So you see all of them cluster together. So whether it is vaccine or natural infection, the difference in risk, you see, is great. But the implication here is that with Omicron, we all have now come into this category of people who have some immune memory, some immune recognition, and hence we can now, with a little bit of care, come out of the pandemic mindset and start living our lives with a new normal. Now, that new normal means due care, but it also means a healthy lifestyle. So if we look at UK, kind of, it's going up and down, but the graph is on the way down. So the 7-day average was nearly 47,000. The new cases were nearly 47,000. So right now, the graph is not hit the baseline, but it is kind of getting there. If you look at US, 100,000, but way down. Israel, 11,000, but on the way down. South Africa, 2,000, 3,000, and kind of flattening out. India, definitely on the way down. The slope is also downward. And if you see, the gap is the biggest here. 7-day average and daily new cases, the gap is the biggest in our country. Looking at our cardinal states, 7-day average, 1,158. New cases, 842 in Uttar Pradesh. Maharashtra, 2,000, with a 7-day average of nearly 3,000. Delhi, 600, with a 7-day average of nearly 750. And Kerala, 8,000 nearly, with a 7-day average of nearly 11,000. So all cardinal states, overall country, we are emerging from the Omicron wave, and we seem to have done okay. If we look at our country's statistics, we have a recovery rate of 98.2%. And as of 19th February, 175 crore vaccines, 75 or 76 crore tests, 22,000 cases in the last 24 hours. 60,000 recovered in the last 24 hours. So this again is a very encouraging sign that the active caseload is also dropping. We have been talking about those 3 pillars: good sleep, good nutrition, moderate activity. And we added a 4th one, saying that anti-inflammatory lifestyle with a vagal mindset is also needed. So today we are going to take one which is the easiest to crack: sleep. We're going to see how sleep is related to inflammation and to immunity, both innate as well as auto. And what are the hacks that you can start implementing from today? So we all know that the human body follows a circadian rhythm in which the best time of highest alertness starts somewhere around 10:30, 11 in the morning and goes on till about 2:30 in the afternoon. The best coordination, muscular coordination, and the fastest reaction times are between 2:30 to about 3:34. The greatest cardiovascular efficiency and muscle strength is around 5 to 6:30. The blood pressure and the body temperature begin to rise around 6:30, and around 8 o'clock or 9 o'clock, melatonin secretion begins to start. Now, all these have implications as to how our day can be structured in sync with our biological clock. So you have a work day that starts in the morning around 9 o'clock. You have the melatonin beginning around 9 p.m., which begins to program you for sleep. And the cache window for melatonin, the window where you get the best sleep for good recovery of whatever you put your body through in the day, is actually 10 p.m. to 2 a.m. And interestingly, I don't think any of us are using that window to sleep. And even if we do, our lifestyle during the day is not letting us have a restful full night's sleep of 6 to 8 hours. So the melatonin, or what people have called the sleep hormone, well, I would say that it is the good sleep hormone. It depends on the light-dark cycle. Its main trigger area is the suprachiasmatic nucleus. And the more we are hooked to technology and artificial light, the less melatonin is produced. So even the sleep cycle tends to get disturbed. if you're looking at the milieu of our body as to how it changes through the day, if you look at the body temperature, it's cycling through a rise in the morning and a rise in the evening. Attentiveness comes a little before this body temperature rise. Cortisol precedes that also by a little while. So you see this between 6 o'clock to 8 o'clock in the morning, there is a rise of cortisol, which is your usual waking up time, followed by a rise in attentiveness, followed by a rise in body temperature. As the body temperature is beginning to fall, melatonin is beginning to rise. Now remember this fact, because this is one of the things which can, and if you see it, is happening in the next wave also. So if you see this, one of the easiest things to do is to make your skin temperature just a little bit cooler to have more melatonin and better sleep. The circadian rhythm and the 24-hour clock is not a new concept. It's a concept which is present in both the Chinese medicine and in the Ayurvedic clock. In fact, our Ayurvedic daily rhythm clock not only talks of a day, but it also talks about seasonality. And it tells you what you should be doing in those windows. So from 10 a.m. to 12 noon, you should be planning, organizing, and taking action for the day. Between 8 a.m. to 10 a.m., you should do your exercise, eat lightly, move your bowel, prepare for the day, gather energy. If you look at what happens between noon and 2 p.m., this is the time of the heaviest meal. 2 p.m. to 4 p.m., keep moving a little. Between 4 p.m. to 6 p.m., this is the time that you should have your last meal and don't eat after sunset. Now, I don't think everybody's following these very strictly, but it's there. It's there in our literature. So what happens in sleep to the brain? Sleep is, a lot of work has gone into studying sleep, but sleep is still an unfolding mystery, I would say. Sleep is the time that we pretend to be dead, but we are not. But it's a time when the body, the mind, the physiology is undergoing a lot of recovery. So when we are awake, there is low voltage, high frequency beta wave in the brain. This is the wave of attention and a little bit of agitation. But when we get into bed, there is a high frequency wave which tends to predominate, a sawtooth wave. This is the alpha wave, which is the wave of relaxation and a relaxed attentiveness. As we go into sleep, the sleep spindles and the sleep K waves emerge. And as we go progressively deeper, the low voltage, high frequency waves tend to emerge. These are theta and delta waves in our non-REM and REM sleep respectively. So as we go into deep sleep with dreams, or into meditation, the theta and delta tend to predominate. These are the waves of detached, delta particularly is the wave of detached awareness, healing, and sleep. Theta wave can be induced in the brain with meditation and improves intuition, working of the brain, and even consolidates memory. Alpha waves are those of relaxed attention. This is the state where you're the most creative and you can visualize things. The beta is alertness, concentration, cognition, things that probably you would be in right now. But there is another wave which tends to come in phases of sleep, and that is the gamma one: insight, peak focus, expanded consciousness. These are the waves which allow the brain to recover. Looking at the sleep cycle, at the top is awake state. So we cycle through non-REM sleep in 3 stages: deepening, and then into the REM sleep, which progressively increases as the night progresses. So the first wave, you might have half an hour to 40 minutes of REM sleep. The second wave, again, half an hour to 40 minutes. But if you look at the final wave, just before waking up, you spend more time in the REM sleep, which is also involved with hormonal recovery. So stage 1, stage 2, and stage 3 non-REM sleep occupies about 4 to 7 hours per night. The REM, or the dreaming sleep, is the 4th stage of sleep, and it gives about 1.5 to 2 hours per night. The non-REM stage 3 and the REM stage 4 are your deep sleep required for recovery. So how does sleep affect immune system? The interleukin 1 beta, TNF alpha, growth hormone, prolactin, cortisol, and leukocyte telomere length have all been found to be affected with both sleep and with immune system function as well as dysfunction. In acute sleep deprivation, that means happening in an episode once in a while, even in acute sleep deprivation, adaptive immunity decreases. The focus becomes from the healing, protecting, counter-inflammatory Th1 response to a pro-inflammatory Th2 response. Lymphocytes decrease. This is also associated with a decreased response to vaccines. If chronic sleep deprivation is there, habitually people are sleeping less, which people have been sleeping less in the pandemic. Several studies, smartwatch wearers, so both Apple and Fitbit have a sleep module, and they have culled a lot of data on their users' sleep patterns and come to the conclusion that by an average, the sleep time has reduced 1.5 to 2 hours during the pandemic. So if there is chronic sleep deprivation, inflammation increases, the balance keeps shifting between a reactive innate immunity and inflammation. IL-6, IL-1 beta, TNF alpha, and TNFR1 increase, and there is increased circulation of leukocytes. When there is an infectious or inflammatory condition, naturally, the body wants to get into sleep. The pressure to sleep is more, and the sleep that we get is more non-REM sleep, slow activity sleep. But the REM sleep decreases. So this is only aiding physical recovery. Now, if there is poor sleep quality and continued sleep deprivation, the telomeres become short, and this is the marker of aging. So, all those college kids, and I've done that too, all those college kids who think they can get by with 3 to 4 hours of sleep and will work late into the night or early into the morning because you've got a lot of work. This is a recipe for accelerated aging because there is DNA repair impairment, there is senescence and cell death, there is DNA instability, and to an extent, also, this has a role in oncogenesis. All this seems to be mediated through mitochondrial dysfunction, which we had touched upon, if you remember, a week or two ago. So what are the factors that make this worse? The lack of exercise, obesity, smoking, alcohol, processed foods, and some psychological disorders are known to be associated with both mitochondrial dysfunction and telomeric shortening. This seems to be mediated through reactive oxygen species and through the mitochondrial energy pathways. What improves both the mitochondrial function as well as the telomeric length? Relaxation, moderate exercise, antioxidants, and some enzyme preparations like omega-3 fatty acids, minerals, carotenoids, and phytophenols, vitamins. These improve both the mitochondrial function as well as the telomeric length. What is the role of mitochondria? Mitochondria are the energy engine of the cell. So without mitochondria, the cell cannot carry out its basic functions for survival. The mitochondria at the most molecular level generate ATP. They are involved in the synthesis of both estrogen and testosterone. They also generate free radicals. These free radicals have both pro-inflammatory and counter-inflammatory cascades required for the fine nuanced dance that our body is doing, quite unknown to how we live. We are carrying out a lot of processes at a ultra micro level in mitochondria. The neurotransmitter metabolism also, mitochondria have a great role to play. Apoptosis, ammonia detoxification, heme synthesis, cholesterol metabolism, fat and carbohydrate metabolism, pyrimidine biosynthesis. So mitochondria are serving a very, very important, crucial role in the cell metabolism. They also have a role in the RNA DNA synthesis and are coded for by 3,000 genes. Now, if the mitochondria get dysfunctional, the energy metabolism becomes dysfunctional. there is increased generation of reactive oxygen species and decreased detoxification of the reactive oxygen radicals. The damage to mitochondrial and cellular DNA actually damages the telomeres. The mitochondrial dysfunction through various mechanisms causes a progression towards tumor, metastasis, or drugs resistance. And if you see, we've got our nuclear factor kappa beta here. If you see, the mediators here are our reactive oxygen species, histone. So there are a lot of things which are happening at a cellular level, which are like that final common pathway. Mitochondrial dysfunction has been associated with diseases as diverse as epilepsy, autism, Alzheimer's, to cardiomyopathy, Parkinson's, muscular dystrophy, diabetes, cancer. So mitochondria are crucial to not just health, but also longevity. Factors affecting the telomere length. It has been found that COVID-19 both promotes shorter length of telomeres, and people with shorter length of telomeres get more severe COVID-19. So it is probably one of those factors in the elderly, the short telomere length, which is not protecting them. We have seen how obesity and smoking, exercise, oxidative damage, alcohol, sleep deprivation, and nutritional factors are causing the telomeres to become shorter. So smoking 1 pack of cigarettes a day over a 40-year period was found to be equivalent to an additional, I mean, in normal aging, telomere chota hoga, but an additional 18 to 20% of telomere length is lost. That means 7.4 years of life compared with non-smokers. Now, if you are sleep deprived, the resetting of the telomere repair and recovery is also affected, because the deepest sleep time between 2 a.m. and 4 a.m. is actually triggered by the melatonin response. The telomeres and mitochondria suffer from too much stress and too little sleep. Even, this study was done in Italy with the night shift nurses, and they found that the nurses who had regular night shifts had increased incidence of breast cancer. And this was not found in normal daytime workers. So as far as COVID is concerned, the telomeric length, long telomere response, is a robust T-cell adaptive immunity, which suppresses the acute pro-inflammatory cytokine innate response, which results in decreased cytokines, increased viral clearance, and mild COVID-19. Whereas in short telomeres, the innate immune response with pro-inflammatory cytokines is very marked, very amplified, and the adaptive response is very low in intensity. So the viral clearance cannot happen, cytokines are more, and the COVID is more severe. as I was saying, in the last 2-3 weeks, जिसकी जो स्पेशलिटी होती है वो कहता है कि यही चीज है जो कोविड के पैथोजेनेसिस में मोस्ट इम्पॉर्टेंट है. So we've seen role of mitochondria, we've seen role of serotonin, we've seen role of monocytes, we've seen role of CCL5, we have seen role of CXCL4. So basically, what this means is that there are a lot of cellular molecular mechanisms which are working together to give us both health and disease. Melatonin seems to be one of those molecules which is crucial to health for its various actions. So it's not just a sleep molecule, it is a very strong antioxidant and oncostatic molecule. It is a potent free radical scavenging molecule which prevents free radical damage due to toxins, heavy metals, or even radiation. So when it's promoting sleep, it is also promoting detoxification of the body to whatever it was exposed to during the day. It has so many actions and in so many areas that it seems to be involved with almost everything in the body. Antioxidative action with free radical scavenging, apoptosis induction, inhibition of cellular proliferation, so decreasing tumor loads, cell cycle arrest, so oncostatic, anti-angiogenesis, decreases inflammation, increased quinone reductase, decreases inflammation, immunomodulation, endocrine modulation. So there is a telomerase inhibition. Melatonin is the molecule that keeps you young. It is an extremely potent molecule of health. And the more time we spend on screens, and I'm guilty, the more time we spend on screens, the less melatonin we have, the faster we are aging, the more natural sunlight we get, the more melatonin we produce, and the better the quality of life we have. So tumors evade body's immune system by suppressing Th1 cellular immunity, and melatonin promotes Th1 response. The tumors are associated with a skew towards a damaging pro-inflammatory Th2 response. Melatonin suppresses Th2, increases IL-2 in monocytes, which drives Th1 dominance. Th1 increases interferon gamma, neutralizes PGE2 in the prostaglandin pathway through its interleukin 2 arm. So melatonin increases interleukin 2, increases interferon gamma, increases anti-tumor lymphocytes, as well as decreases the toxicity of cytokines by reducing thrombocytopenia. That means it gives us adequate thrombocytes, adequate Th1 cells, creates an anti-inflammatory milieu by attacking the first molecule on the prostaglandin pathway, PGE2. Melatonin is working on the NLRP3 inflammasome also, suppressing it. It is working on the nuclear factor kappa beta pathway also, suppressing it. These pathways with mitochondria giving us enough energy are the ones which are counter or anti-inflammatory in our body. And these are the ones, incidentally, also that ivermectin is working on. So this is, of course, a lot of molecular biology. We'll not go into that. But if you remember the NLRP, inflammasome, and nuclear factor kappa beta, half the work is done. The three main molecules to look for, apart from melatonin, are interleukin-1, TNF-alpha, and PGD2. These show a decreased level with decreased non-REM sleep. That means there is a direct correlation in the length of sleep and in the concentration of anti-inflammatory molecules. They are increased with increase in non-REM sleep, but also they decrease the REM sleep. The levels are highest during sleep. Interleukin-1 induces growth hormone from GABAergic pathways, and this is done only during REM sleep. The anti-inflammatory cytokines IL-4, 10, and 13 also inhibit sleep. Now, what are the functions of cytokines in the brain? So if you see here, there is a bidirectional relationship between sleep, interleukins, and inflammation. So during sleep, these cytokines allow the brain to form, scale new synapses, to eliminate ones which are not needed, create new nerve cells, also kill the ones which are not working. And there is overall functional development with neuronal migration, which is correlated with very complex human behaviors, regulation of sleep, appetite, aging, learning and memory, and also with mental health. Anxiety and depression are more commonly associated with people who have shorter sleep times. What does sleep deprivation do? Sleep deprivation increases inflammatory cytokines IL-1, IL-6, and TNF-alpha. These work on microglia, neurons, and astrocytes within the blood-brain barrier. In the systemic circulation, they affect the lymphoid tissue. The Th1 response is decreased. The pro-inflammatory tumorigenic Th2 response is increased. The CD8 T cell function and natural killer cell activity is decreased. Antibody production and plasma cells are decreased. Antigen presentation by T cells and dendritic cells is decreased. All this results in increased tumorigenesis and increased susceptibility to infections, because this is cueing to a blunted innate and immediate response. The inflammatory mediators, acute phase reactants, IL-1, IL-6, CRP, and TNF-alpha are all increased. So there is increased neurodegeneration and increased cardiovascular disease. So what is the role of sleep in immune-related diseases? What are the risks and what are the outcomes? So we define short sleep as sleep of less than 5 hours. This is associated with elevated CRP and IL-6, TNF-alpha, interferon gamma, as well as IL-1. There is associated leukocytosis. Is this mediated via cortisol, or has this kind of nuanced dance between IL-6, TNF-alpha, and cortisol going on? There is also an increase in adhesion molecules so that the blood viscosity increases. There is reduced NK cell activity, decline in naive T cell counts, and reduced immune competence. And there is shortening of the telomeres on the leukocytes, which is senescence and aging, both in terms of immunity as well as in terms of physical health. The final common pathway is the nuclear factor kappa beta pathway. So there is decreased metabolic waste clearance. There is modification of the gut microbiota. So there is increased inflammation. And all of them are working on the nuclear factor kappa beta. And melatonin is suppressing that pro-inflammatory state. Growth hormone is suppressing that. Norepinephrine is creating more inflammation. If you look at these cytokines, chemokines, which through the nuclear factor kappa beta are coming into the body, this is creating a more Th2 phenotype, which is pro-inflammatory. So the normal balance between ghrelin, which is the hormone of hunger, cravings, and leptin, which is the hormone of satiety, is disturbed. So if you stay awake longer, you eat more, snack more, and decrease your insulin sensitivity, and you increase your cortisol. If you are sleeping more, then you increase your leptin, which causes more satiety, less appetite, which also increases human growth hormone, which causes more opportunity to build lean muscle mass. So sleep is working on almost every level of our energy metabolism. If we look at growth hormone, you see in the awake state, it is practically undetectable. It increases during the first half of the night. Prolactin starts to rise with the growth hormone and stays high throughout the sleep cycle. Cortisol is the lowest during sleep and hits a peak as we are waking up in the morning. Norepinephrine is increasing a little after we are awake and is the hormone of attention. So if you want to have good consolidation, nice synapses, good recall of whatever you did, these hormones are creating the milieu for brain recovery and toxin elimination. The effect of poor sleep is not restricted to just the brain and the central nervous system axis, but also through the increase in cytokines on the peripheral system. It affects all cells of immunity. It affects all critical organs, including liver, heart, gut, even the stomach. Looking at the day active subjects, the growth hormone peaks during the first half of sleep and peters out during the later stages to stay low through the waking hours. Night workers do not have this surge. They do not have the melatonin trigger. They do not have this surge. Sleep deprivation hence causes a dysregulation of the neuroendocrine system. It increases the stress. It increases the nocturnal sympathetic activity, decreases the parasympathetic activity, activates pro-inflammatory pathways, and increases blood pressure. Is there a system in the body which is not connected? Sleep fragmentation and hypoxia causes decrease in blood-brain glucose utilization, increased sympathetic activity, altered cortisol growth hormone rhythm. We have seen that growth hormone peak nahi aati, increased inflammatory markers, abnormal adipocytes and monocyte activation, decreased leptin, increased ghrelin, increased appetite, and a minimal change in energy expenditure, so obesity. This increases insulin resistance, and the increased sympathetic activity decreases beta cell function, so there is hyperglycemia and type 2 diabetes. So sleep deprivation not only causes you to feel fuzzy and foggy and less than able to do your work, it is actually at a molecular level causing a lot of havoc in the body. There is a definite correlation in chronic inflammatory diseases and sleep deprivation. So we've seen all this, disturbed sleep causes heart rate variability to go down, sympathetic nervous system activity to go up, cortisol, leptin, ghrelin, melatonin, IL-1, IL-6, all of this we have seen. But what does it do? So it makes the body unable to recover from the toxic damage that it faces during the day. It creates problems in memory making, consolidation, and recall. All this creates, those dementia states, aging, mental health issues, as well as oncogenesis, hypertension, type 2 diabetes. So it's a system which is very deeply connected. What is the dance of recovery and disease in IL-6 and sleep? IL-6 is a pro-inflammatory pyrogenic cytokine, which is increased in both sleep deprivation and excess of sleep. It is also found to be increased in autoimmune diseases like rheumatoid arthritis and psoriasis. IL-6 decreases slow wave sleep in the first half of the night, which means that it decreases the growth hormone surge. But it increases slow wave sleep in the second half. It seems like the second half slow wave sleep might be mediated through the cortisol offset, which we are expecting at the time of waking up. It promotes a Th17 response with impaired T regulator cell function. It induces hepcidin in hepatocytes, which decreases iron absorption. Now see how the whole thing is connected, which decreases iron absorption from gut, and also decreases the iron release from macrophages. So the hyperferemia causes fatigue, irritability, and restless leg syndrome. Restless leg syndrome causes disturbed sleep, and disturbed sleep causes increase of IL-6. The immune cells and sleep hence have a bidirectional relationship. IL-1 beta and sleep, this is the dance of autoimmunity. IL-1 beta is pro-inflammatory. It is also pyrogenic. It has been implicated in the pathogenesis of rheumatoid arthritis, SLE, and even autoimmune thyroiditis. This increases non-REM sleep via the IL-1 receptors and mediates inflammation-related sleep in illness. So when you fall ill, you feel more sleepy. You want to get into the recovery through your sleep. This is mediated by interleukin-1 beta. This is associated with increased cells of immunity, which can inappropriately cause autoimmunity. So plasma cells increase, M1 macrophages increase, and dendritic cells also increase. These are all antigen presenting cells. The inflammasome mediated cytotoxic T cell activity is also increased so NLRP pathway is affected by IL-1 beta. TNF alpha and sleep. This is the cascade of ongoing inflammation and oncogenesis. So TNF alpha is also pro-inflammatory. It causes a hypothalamic reset, so the temperature rises. It is found to be increased in immune complex diseases like rheumatoid arthritis and SLE. It induces other cytokines and chemokines. So it recruits immune cells and suppresses T regulator cells. TNF alpha enhances nociception. So pain perception is increased by TNF alpha, both in the central and the peripheral nervous system. Could this be the reason for chronic fatigue and myalgia in CFS or long COVID? Because we know that TNF alpha is deranged in long COVID. It promotes non-REM sleep and in higher doses suppresses the REM sleep. So the recovery sleep is suppressed by TNF alpha. It mediates fever through the non-REM and REM disturbance. It resets the hypothalamus. So bacterial endotoxemia actually raises TNF and increases sleep. Again, a bidirectional thing. So TNF alpha बढ़ेगा तो आपको नींद आएगी. अगर बैक्टीरियल टॉक्सिन्स हैं तो TNF alpha बढ़ रहा है, लेकिन बढ़ता हुआ TNF alpha आपको restless sleep भी देगा because pain perception increases and restful sleep is suppressed. So what are the associations with insomnia? You can actually sleep your way to good health. Insomniacs have a higher level of evening cortisol rather than the morning cortisol, which is seen with healthy sleeping habits. The higher cortisol shift is also seen in night shift workers. Cortisol is raised in non-obese males and obese females with obstructive sleep apnea. So if we were to do fasting cortisol in non-obese OSA, we will find obstructive sleep apnea. We'll find that it is high in non-obese males and obese females. This hypothalamic pituitary adrenal dysfunction and cortisol level rise can actually be reversed with CPAP or by losing weight. Now, what happens in sleep? The local brain lymphatic system, the glymphatic system, is 10 times more active in sleep. The brain cells shrink about 60% in sleep for facilitating waste elimination. There is more activity to create new synapses. So whenever you receive new information, you're listening to me right now, you're internalizing information. This is creating synapses. Sleep allows these synapses to be actually consolidated. It allows for myelination and metabolic processes to convert information into short-term memories, and over a period of time, the short-term memories to be consolidated into long-term memories, which allow us to have better recall, better decision-making, and a better quality of life. So is sleep us pretending to be dead? Well, at a level, physically, yes, it is. But in fact, sleep is a metabolically extremely active phase of our body. The fountain of youth. As I have said, the growth hormone peaks during first half of the night. The cache window for growth hormone is that 10 p.m. to 2 a.m. window. The maximum secretion is if you deepen your sleep in that window. It allows you to have good lean muscle mass. It regulates glucose metabolism and insulin sensitivity, and it is an anti-aging hormone. So the three big players, TNF alpha, interleukin 1 beta, and IL-6, are working in a bidirectional manner to increase inflammation and decrease recovery. From this talk, what are the simple hacks that we can implement today so that from tonight our sleep is better? Get some natural sunlight in the day. As little as 20 to 30 minutes of natural sunlight allows the retina to understand the difference between natural and blue light and stimulates melatonin at the right time. Switch off at least 2 hours before sleep. Keeping blue light exposure for 2 hours delays and suppresses melatonin by at least half an hour. So even if you get into bed at 10, but you have been on the computer for the last 2 hours of being awake, or on the TV for the last 2 hours of being awake, or on the phone, the melatonin is suppressed, will kick in only at least half an hour to 40 minutes later, and in less amount. So the sleep will not be very restful and recovery will not be as good. Green light is 3 times less impactful than blue light. So, blue light filters or green light screens or the night mode that Apple has provided, these are all good things to do just if you are not able to switch off, but it would be good if you do. Caffeine occupies the same receptors as melatonin, the adenosine receptors. And so even if melatonin is there, it will not be able to act. So, and of course, there are some people, so agar main chai peeti hu, to I can't sleep. But if I have coffee, I can sleep the next minute. But that sleep is not, that sleep is not the deep sleep of melatonin, and the quality of sleep is affected. So if you can cut these beverages for at least 4 to 6 hours before your bedtime, it is good. Easiest one, temperature in your bedroom. So it has been found that people with good sleep have a skin temperature, and good melatonin have a skin temperature which is about 1 degree less than people who have poor sleep. So if you keep your and this is counterintuitive, because agar mujhe thand lagegi to main soungi kaise? That doesn't mean that you don't take a blanket. It doesn't mean that you don't keep yourself warm with socks or whatever, but keep your room cooler rather than warmer for better quality sleep. Time your sleep. You should follow a regular sleep-wake cycle. Use the cache time of 10 p.m. to 2 a.m. If you have to do an evening workout, shift to a morning workout, it is better. But if you have to do an evening workout, it should be at least 4 hours before your expected sleep time. Meditate, calm down. Some people are not able to do that. And there are methods in which you can, you can calm down the brain. Pink noise, the noise of falling rain, or the noise of a detuned radio station, or binaural beats. So binaural beats में क्या करते हैं, that दोनों कानों को थोड़ी सी different frequency दे देते हैं. So say this side you are having music playing at 110 hertz, and on this side you're having music playing at 100 hertz. So the difference between the two is 10 hertz, and the brain starts to produce that 10 hertz frequency, which is alpha, which is relaxation. So you can fall off to sleep sooner and quicker and easier. So at least apply 3 from today. Get out in the sun, switch off 2 hours before sleep, and keep your room slightly cooler, perhaps. Over the next week, try to regulate your sleep-wake cycle. Getting into bed at 10 may not work for everybody, but it is ideal. At least try to get into bed at 11. I'm going to put into place all of them because I've had very bad sleep hygiene for the last 1.5 years or so. Thank you so much for listening to me today. Do we have any questions? डॉक्टर कपूर आपका म्यूटेड है. So if there are no questions, then there are only two things, जैसे सर कहते थे, या तो बहुत इजी था या बहुत मुश्किल था. डॉक्टर विनय, यू हैव रेज्ड योर हैंड. आप क्या अनम्यूट नहीं कर पा रहे हैं? वेट, लेट मी सी. आई थिंक
अब हो गया मैम.
हाँ जी, हाँ जी.
Thank you so much for touching this topic.
I know it was...
I think the sleep is the thing which we least bother about.
And it has the maximum payoff. अगर आप सिर्फ sleep को repair कर लोगे तो it is more impactful than repairing diet and exercise.
हाँ जी. डॉक्टर के अग्रवाल कभी साइकेट्री पे बात करते थे मूलचंद में, तो वो कहते थे कि as the food is important, water is important, sleep is also important. So triad में वो डालते थे कि भाई good sleep quantity wise and quality wise. तो अभी तो OSA पे बड़ा एक फोकस आ गया है. पहले तो स्नोरिंग को ही इग्नोर करते थे लोग. अभी जैसे बप्पी लहरी का वो एट्रीब्यूट कर रहे हैं कि OSA की वजह से हुआ. थिक नेक और शॉर्ट नेक की वजह से उनको OSA की प्रॉब्लम थी. तो आप कैसे डील करते हैं स्नोरिंग वाले पेशेंट्स को, जैसे कैसे समझाते हैं?
मेरा तो फर्स्ट ये रहता है कि वेट मैनेजमेंट.
हाँ जी.
I give them 1 month to repair that. And अगर वो जर्नी शुरू हो जाती है तो 80% पेशेंट्स को और इसके आगे कुछ नहीं चाहिए.
अच्छा.
अगर वो नहीं हो पाता है, then we do a sleep study and decide whether the patient will take CPAP or undergo sleep surgery. So in that we will increase the space available for breathing in the oropharynx. तो उसमें हमारे को सारा एक्स्ट्रा टिश्यू निकालना पड़ता है. Not a very friendly surgery because post-operative period में at least 2 to 3 weeks there's a lot of inflammation, there's a lot of, but overall results are very good, not just for snoring but for obstruction also.
Okay.
But 80% of the people don't need anything except weight management advice.
Okay. Reducing weight is also a problem, you know. That is also a very ticklish issue with the patients. So going for CPAP.
And you know what I tell them? I tell them that if you take CPAP, then your motivation to lose weight will go.
It will go, yes.
Because
definitely.
जो आपकी main problem है वो कुछ और है. It's like treating a headache by aspirin and not taking care whether it is the chashma or the tumor that you need to take care of.
Yes, yes.
So I tell them that, you know, your motivation and drive to lose weight will go. So I would suggest that you don't immediately take CPAP, work on yourself. But given the fact that it is causing so much problem, if you totally must, then take CPAP or undergo surgery. So if I'm asking only for 5 minutes in a day, I tell them कि आप कुछ भी करते हो ना, don't change anything else. Only two things. One, 5 minutes of staircase in the morning, and whatever the speed. It does not matter कि आप 5 मिनट में सिर्फ एक बारी ऊपर नीचे जा रहे हो. Doesn't matter. लेकिन 5 मिनट के लिए रुकना नहीं है. और आप हफ्ते के अंदर देखोगे कि वो एक बारी से दो बारी से 4 वो बढ़ता जाएगा और वेट घटता जाएगा. The second change that I ask of patients is zero sugar.
Yes.
Sugar has to be stopped completely. So chai coffee में भी sugar मत लो. Only two things if you do, you will lose weight at the rate of 1.5 to 2 kilos every week to 10 days. And if you're able to do this morning and evening both times, if you're able to do it as soon as you get up, and if you're able to do it just before going to sleep, the weight loss is seriously remarkable. Remarkable.
I tried this 2 weeks में मेरा 3 kg कम हो गया with just using carbohydrates and this thing. It is very effective, yeah. Carbohydrates and sugars कम करके. And I took just vegetables and fruits like उससे बहुत फर्क पड़ा.
Very effective.
Yeah.
I have seen weight loss to the tune of 17 to 20 kg in 1 month.
Oh.
In really obese individuals. और मेरे से गलती ये हो गई कि मैंने उसकी फोटो नहीं खींची. I actually recognized that patient only by the way he addressed me. वो जब पहली बारी आया था उसने मुझे कहा डॉक्टर साहब, और जब अगली बारी आया तो जब उसने मुंह खोला तब मुझे समझ आया कि ये वो वाला पेशेंट है. Remarkable, sir. सिर्फ यही 2 चीजें.
No, results come, definitely come if you stick to the guidelines.
1 महीना 5 मिनट मतलब you know, you
not much to ask for.
Not much to ask for health.
Yes. Surgery, you have mentioned, do you remove the extra tissue? You have to be very selective about the patients.
So we are, yes. So extra tissue means अगर tonsils आप देख रहे हैं तो tonsillectomy करिए. अगर यूविला पेंडुलस है तो यूविला को थोड़ा सा सेक्शन करना पड़ता है. अगर बल्कि सॉफ्ट पैलेट है तो वो थोड़े से पार्शियल थिकनेस कट्स देते हैं, so the scarring reduces the volume as well as it opens up the. So this is all very specialized surgery, and sometimes and St. Stephen's में Dr. Susan काफी कर रही हैं. Sometimes you even have to do some pillar stitching. So जहां पर मुझे लगता है कि सर्जरी की जरूरत है मैं उनको रेफर भी कर देती हूँ कि भैया, you know, this is actually very unpleasant surgery, but yeah, so if you need it, you need it.
Madam, you have mentioned in night workers that there are chances of the breast cancer in the females, and what about the
that was a study
in the males?
So this study only involved the females. It is a study in Italy. I'm sure oncogenesis, because it has been related to melatonin. कि वो melatonin की surge नहीं होती है, so the oxidative damage that you're going through is not detoxified. So I'm sure even in males it would be there, but I haven't been able to find a study. So it's related to melatonin, not per se to the type of cancer.
And what about the type 1 diabetes? What is the causative factor?
Type 1 diabetes is in itself a big topic. Sir, bataiye.
No, you
Dr.
have mentioned
Arora.
that this melatonin reduces the type 2 diabetes. But what about in the type 1 diabetes?
डॉक्टर अरोरा आए थे अभी. ये वाले वो टॉपिक्स हैं जिनको लाइटली नहीं लिया जा सकता. Maybe we can go into that too.
And
But
what about
more of a genetic stuff.
and what about the afternoon snap? What is your guidance or opinion?
What about?
Snap. जो दोपहर का जो लोग खाना खाने में थोड़ा जोखा खाते हैं.
Afternoon nap. So afternoon nap and is वो जो अगर हम bio clock देखें ना, circadian rhythm. Let's see that again once more. Let me show you this again. If you see this, जब आप अपना highest, heaviest meal लेते हैं between 12 and 2 p.m. This I'm going by the Ayurvedic clock. The Chinese clock is much more. वो अपने meridians के हिसाब से करते हैं. उनके 12 meridians हैं. So वो उसके हिसाब से करते हैं. 2-2 घंटे हर एक meridian को दिए हुए. Very smart also. I mean that is also a very smart thing, but it is kind of matching with our Ayurvedic clock. Let's do the Ayurvedic clock. If you have your heaviest meal between 12 and 2, the blood circulation tends to go to the gut. This is the stage of highest metabolism. Hence, your brain does not have the blood supply that it needs. Hence, you have an afternoon slump. If you consciously move at that time and do some simple brain activities or pleasurable brain activities, then you divert some blood flow to the rest of the body and to the brain, and hence you can fight that afternoon slump. But body एक तरीके से wired है और वो हमारे को हर एक चीज करने का सही टाइम दे रही है. हम हैं, so the body is set to a 12-12 day-night cycle. We, however, have increased the exposure to light, and by doing so, we have decreased our ability to recover in the darkness that our body is geared for, genetically primed for. आप आफ्टरनून स्लम्प फील करते हैं तो वो आपकी मेलेटोनिन सर्ज के साथ नहीं इंटरफेयर करता. लेकिन अगर आप रात के 10 बजे टीवी देख रहे हैं या फोन पर हैं या लैपटॉप पर हैं तो आपकी मेलेटोनिन सर्ज 1.5 घंटे के लिए सप्रेस भी हो जाती है और पोस्टपोन भी हो जाती है. और अगर मेलेटोनिन पोस्टपोन हो गया तो एंटीऑक्सीडेंट नहीं होता, ग्रोथ हार्मोन नहीं होता, ग्रेलिन बढ़ जाती है, लेप्टिन घट जाती है, तो इतना कैस्केड शुरू हो जाता है that we are not able to recover from it.
Ma'am, melatonin is very much promoted these days by the companies.
Yes.
What do you think? It is a sleep inducer or sleep regulator?
No, it is not a sleep inducer. So melatonin does not does not increase the duration of healthy sleep. It only helps you to fall off to sleep if other things are in favor. So it's a good way to reset after jet lag or an occasional sleep deprivation, but it does not promote, so say for instance, the REM sleep. which is the recovery part of the sleep.
Yes.
For that, you have to actually build healthier habits.
Yes, yes.
Not only what is the effect of this afternoon nap on inflammatory markers like IL-16, FL5, etc.
Sir, I have not been able to find any data, but as I said, the afternoon nap per se does not interfere with the melatonin surge that you get. Secondly, जो एक्सरसाइज के बाद या मील के बाद जो acute phase reactants हैं और inflammatory markers हैं, ये दोनों बढ़ते हैं. But this is the hormesis. You know, you have to have some inflammation for the body to decrease it, and that's how the dance is there. So in all probability, after a meal, during the afternoon nap, also there will be some balancing of the inflammatory markers which is going on.
मैडम आयुर्वेद में ऐसा बताया है कि you should take the afternoon nap for at least 15 minutes.
So that's what I'm saying कि खाना खाने के बाद और एक्सरसाइज के बाद inflammatory markers बढ़ते हैं. So अगर आप उस टाइम पर 15-20 मिनट का नैप लेते हैं तो जरूर वो मार्कर्स थोड़े से कम होंगे. लेकिन ये आफ्टरनून नैप आपकी मेलेटोनिन सर्ज को किल नहीं करता.
Okay. How we can reduce that? Because see, I'm very just fond of having a long nap after, say, 1 hour or more, even 1.5 hours. So at times I find very difficult, especially if I have to go for a meeting or driving or some other important meeting. So do you find any ways to reduce that, or you avoid it?
The duration, sir, मैं intermittent fasting करती हूँ. So I don't have breakfast, and my first meal is around 1:32 when I have my lunch. Now with intermittent fasting, I have found that I don't have this afternoon slump. But I think everybody will have their own method of dealing with it. The easiest, और ये मजाक की बात है, मतलब लोग कहते हैं कि एक चम्मच पकड़ के सो जाओ, तो जब चम्मच छूटेगा, आपकी मसल टोन कम हो रही है, जब चम्मच छूटेगा और खड़ाक करके गिरेगा तो आपकी नींद टूट जाएगी. तो वो मतलब that is body's way of alarming you to wakefulness.
मतलब मेरे को तो कई बार प्री लंच भी हो जाता है, मतलब हम सोता है.
Coffee sir. At that time coffee is good. And because it occupies the same receptors, adenosine receptors. At that time coffee is good.
At times it's so severe कि मतलब आप पेशेंट से बात करो, बीपी चेक करो, मन करता बस छोड़ दो.
नहीं, at that time it is like that.
Nice, very good lecture. I think it was very बहुत अच्छा.
Thank you so much, Dr.
There are some patients who say that we are not able to sleep at all before 12 o'clock, 1 o'clock, and their whole sleeping pattern is disturbed. So can we help them giving pharmacologically or some method so that they are able to
अगर आप सिर्फ एक लेयर डीपर जाओगे ना तो उनका कुछ ना कुछ आपको मिल जाएगा. वो टीवी देख रहे थे, वो फोन पर थे, वो दारू पी रहे थे रात को, कुछ ना कुछ मिल जाएगा. So the better thing to do,
अपना शेड्यूल चेंज कर दे, it will change.
नहीं, अपना वो आंखें बंद करके सोए रहते हैं, 3 बजे से पहले नींद ही नहीं आती. We are not able to sleep at all. We are closing, everything is. So can we help them in any way?
So you can totally help them with pharmacologic or non-pharmacologic. मैंने आपको कहा ना binaural beats try कर सकते हैं.
जी.
Even meditation will help.
वो हाँ, so binaural beats induces meditation state without
and
having
what
to
about
meditate.
melatonin?
Yes.
Melatonin भी दे सकते हो.
Very good.
for a short time, so that once their pattern is controlled, then we can stop it gradually.
We totally can do that. There is absolutely no problem in doing that. But what I'm saying is कि कुछ ना कुछ जरूर ऐसा मिलेगा जो अभी उस लेयर के नीचे जो अभी आप नहीं पकड़ रहे.
It is just like आपको शराब छोड़नी है, वो खुद छोड़ना नहीं चाहते तो शराब क्या छोड़ोगे? Same. जाएगा तो सोएगा ना.
और मेरा तो ये है कि at least every Saturday night I am making this presentation, so I am sleeping late. But मैंने अब decide कर लिया है कि मैं this is one thing I'm going to repair. So March is going to be my sleep hygiene month.
Dr. Nidhi, meditation में ये कहते हैं one meditation is equal to good sleep time. Like, there are people who manage without sleep also, only with meditation. So it gives so much of alpha waves and beta waves.
Yes, absolutely. Very true.
And all, people have recovered psoriasis and this thing, rheumatoid arthritis only by meditation.
Yes, and reversed diabetes. Diabetes.
Yeah. So meditation we must promote to the patients because it is
absolutely.
A very healthy thing.
Absolutely.
Dr. Meenakshi आज
डॉक्टर मीनाक्षी के भाई की शादी है तो वो आज उसमें बिजी हैं.
Madam, is there any role of the Pippri and Ashwagandha in Ayurveda for the sleep?
सर मुझे नहीं पता आयुर्वेद के बारे में ज्यादा, लेकिन मैं इन सब चीजों मुझे ये पता है कि आयुर्वेद is very very rich in its effect and we have lost the science. ये हमारी गलती है. तो अगर आयुर्वेद में लिखा है कि ये चीजें काम करती हैं तो प्लीज बिलीव इट.
अश्वगंधा अच्छा काम करती है. It's very good.
मतलब मुझे
combine all therapies. I am believing that all holistic and even naturopathies and all these are very effective. We must combine everything to treat a patient.
Yes,
because they are very effective. Things are very effective.
Very effective.
I have seen like in naturopathy for reducing weight, they give enemas and Vaman, जिसको कहते हैं 1 week. It all removes the toxins like alkaline pH करके and it is very effective. Things are very effective.
Right.
आयुर्वेद में ब्राह्मी, शंखपुष्पी and अश्वगंधा अगर ये तीनों हैं, they are very good. You can say sedatives. Yes, you can calm down.
Yeah, अमृत रिष्ट आता है उसमें ये सब तीनों ही है. So they are effective in that.
Okay,
so
thank you.
I think yeah. Thank you so much everybody. This was
very nice. Thank you.
Thank you.
इतना डिटेल डॉक्टर निधि कहाँ से लेते हो? इतना स्टडी करते हो? बहुत डिटेल में